China has reported 2 COVID-19 related deaths in Beijing, but questions remain over the true number of casualties since restrictions were eased. The latest deaths were the first reported in weeks, despite the government pivoting away from their zero COVID strategy. TICKER's Adam Hancock reports now from Singapore.
When authorities in China finally relaxed pandemic restrictions, many experts predicted that the country would see a huge number of deaths. But so far, according to official data, that simply hasn't materialised. But with concerns over the effectiveness of the vaccines that have been used in China and also worries over low vaccination rates amongst the elderly population, for many experts, this official death toll simply isn't stacking up. Now, judging by reports on the ground in China, things could well be worse than the official line that is being given. The Reuters news agency says that funeral homes and crematoriums in Beijing are struggling to cope with demand, and they're also facing their own staff shortages as the virus rips through the capital. There's also reports on social media in China of people questioning the official death toll, saying that they know people who have died from the virus. Now, some are blaming this on how China is framing COVID deaths. They reportedly only count deaths when someone dies directly from the virus, which is unlike many other countries who count deaths from any causes within a certain number of days of a positive COVID test. It's also very hard now to judge the official infection rates in China because the country has stopped reporting asymptomatic cases, largely because it was unable to track them anymore as they've stopped mass testing and many people are testing less on a day-to-day basis. Now, one of the country's top health experts is predicting that China will see 3 big waves of COVID over the winter. They think that they're currently in the first wave, which will last until mid-January. Then the second wave would begin at the end of January when people start travelling around ahead of the Chinese New Year holidays. Then the final wave would come in late February to early March when people return from the holidays, go back home and go back to work. And with so many people in China having never caught the virus before, we would expect these waves of infections to be pretty big. And the question remains if the country's medical system can stand up to such huge case numbers. Reporting from Singapore, Adam Hancock for TICKER News.